Great. Hello, everyone. Welcome to our 2025 Diabetes Wellness webinar series. Very excited to be starting off with Kristina Schmidt. She is one of our clinical pharmacists with Stanford Medicine Partners clinics in Emeryville and Castro Valley. She is a certified diabetes care and education specialist and holds a board-certified advanced diabetes management certification. Prior to joining Stanford Health Care in July, she practiced as an ambulatory care clinical pharmacist with University of Southern California and Los Angeles Christian Health Centers, working with underserved patient populations. She is interested in helping patients take control of their diabetes self-management through the use of continuous glucose monitoring, which is perfect as her topic is getting the most out of your blood sugar readings. So Kristina, take it away. Oh, also, if you have any questions, feel free to just drop them in the chat or the question and A function, and then we will address them all at the very end.
All right. Well, thank you for that introduction. I'm Kristina. I'll be leading your talk today. This is a topic that's really near and dear to my heart, something that I'm really passionate about. Admittedly, this is going to be a pretty packed talk, so let's get to it. So we're talking about getting the most out of our continuous glucose monitors. We'll start by just defining what is a continuous glucose monitor and how does it differ from my regular finger stick glucometer. I'll go through how to make the most out of the blood sugar readings and all the information that you get. I'll talk about some of the newer products. There's a couple of over-the-counter products that have come to market in the past year, highlighting one that I've recently tried out, the Stelo, but there's a couple that have that are good, that are available to patients without a prescription. We'll do a quick comparison about which product we should choose, and then a couple of tips for success at the end. All right, so what is a continuous glucose monitor? So it is kind of exactly what it sounds like. A continuous glucose monitor is a device that measures your blood sugar continuously. So typically the device will display a new reading every 1 to 15 minutes. Normally they're worn through continuously for 10 to up to 15 days, depending on the product. Actually, there's some that could even be worn longer. It allows you to track the way that your blood sugars change throughout the day. And the reason why these products are so impactful, especially if we're living with diabetes, is we can use these readings to not only track the way our blood sugar responds to our diabetes meds, but also the way our blood sugar changes after we eat, after we exercise, after a stressful day, when we're sick. So over here, these are some common components of a continuous glucose monitor. Most feature some sort of sensor that is worn on your body, and then some type of device that you can use to view the readings. So be it a smartwatch like your Apple Watch, your smartphone, or an external device. And then if you're someone with an insulin pump, you can also view your the readings on your insulin pump as well. And then how do these work? So I mentioned that CGMs feature a sensor. Right here at the top, we see a sensor sitting on top of the skin. Common misconception, people think that there is a needle stuck under the skin. That is not the case. It's actually a very thin, flexible hair-like filament that sits right below the skin into an area called the interstitial fluid. And basically what happens is blood sugar goes from down at the bottom here, which is your bloodstream, into this fluid, and the sensor is able to read your blood sugar readings. And so now what's the difference? So a lot of us, if we're living with diabetes, we already probably have a finger stick glucometer. How do the two differ? So to the left over here, we see finger sticks. So when we take a finger stick, it's a snapshot in time. So even if we take a finger stick multiple times throughout the day, we may only have a few readings. The difference is if we're wearing a continuous glucose monitor, or CGM for short, the monitor will actually fill in all of the data in between. So we may actually be surprised sometimes that we may not realize that we've been going low and not noticing it. We may have high spikes that were never captured by finger sticks. So basically CGM kind of gives us a bigger picture of what's going on with our blood sugar throughout the day. All right, so there's a lot of CGM products. This is a sample of most of the products that are available. For the purposes of today, we'll just focus on 4 of the most common, 2 that are now available without a prescription, and 2 that are commonly prescribed. All right. So let's just kind of talk about what kind of information we can get from most continuous glucose monitoring products. So let's go back to basics for a moment. So a lot of us already know about A1C testing. So A1C testing is normally a lab test, a blood test performed every 3 to 6 months. This gives us an idea of our average blood sugar over 3 months. Finger sticks gives you a snapshot in time of what your most recent blood sugar reading is. These have been useful for years for monitoring our blood sugars, but there are some limitations. Now, let's kind of talk about, again, your A1C goals. For most patients, A1C goal is less than 7%, but remember, depending on our plan with our healthcare providers, we may decide upon a different A1C goal, either a little bit lower or a little bit higher, depending on your plan with your healthcare team. Recap on what we have historically looked at prior to CGM. Blood sugar targets, typically these are the targets that we're looking at when we're doing finger sticks. So remember, A1C goal for most patients is less than 7. Before meals, we look for levels between 80 to 130, 1 to 2 hours after a meal, less than 180. And then definition of too low is typically defined as less than 70, a reading of less than 70. So this is kind of stuff that we knew before when we're doing finger stick blood sugar monitoring. Now piecing it all together, what extra value does CGM give us? Now we're also looking at a new metric that we call time in range. So time in range is defined as the time spent between 70 to 180 throughout the day. So remember, going back to our blood sugar targets, 70, below 70 is too low. And then 1 to 2 hours after a meal, we want to keep that blood sugar below 180. So if you think of it that way, that's kind of where we get this target range. And now, why is time in range a little bit more, why can this give us some added value? So A1C, again, is an average of your blood sugar over 3 months. However, remember, it's an average. So if we're having extreme highs and extreme lows, we may be reaching an A1C of 7, but you can see the difference here. You may not be in target range so often. So this metric, time in range, actually gives us a little bit better idea of how tightly controlled your blood sugar is throughout the day. For an A1C of 7% or lower, we typically target right here in the middle. I always tell my patients we're looking for passing. So time in range of 70% or greater corresponds to an A1C of 7%. Right. So now kind of going back to CGM, continuous glucose monitors. Most continuous glucose monitors will allow you to not only look at your most recent blood sugar reading. So remember I said every 1 to 15 minutes we'll get a new reading, but also it'll allow us to track this new metric, time in range. And now I know it's a little bit of a busy slide, but the other thing I wanted to point out here, I mentioned that A1C goals can be individualized according to the person, depending on the person, according to the plan that you have laid out with your healthcare team. In the same sense, we can also individualize time and range goals. So down here at the bottom, so A1C of 7% corresponds to an time and range of 70%. But if we're going for a higher or lower A1C goal, we may also aim for a higher or lower time and range goal. Right. So now we're using the app. We have this new metric, time and range. How do we use the data that we have to improve our time and range? So remember now, we're tracking our blood sugar throughout the day. How do we make the most of this technology? So number one, I always recommend that we interact with the app, open it up, actually use it, view your blood sugar readings, and not only that, take notes. Pretty much all of these products have a note-taking feature. The apps will allow you to track meals, physical activity, medications that you've given, including insulin, and any other notes that may have affected your blood sugar that day, be it stress, if you've been sick. I think this is a pretty important function because this will help you reflect on your blood sugar pattern and your blood sugar levels later. Number two, make sure you're paying attention to which foods cause your blood sugar to spike. And so it's not only the food choices, we're also looking at portion sizes. We can use this information to kind of start trial and erroring, like doing a trial and error of which low-carb alternatives. We can start swapping out. And then see what happens when we eat different mixes of foods. So you'll see sometimes, or we'll often see that when we include more protein, when we include more veggies into our meals, it may not cause our blood sugars to spike. Compare protein-rich and plant-based foods with heavier carb foods. And try starting your meal with maybe a dinner salad. Sometimes starting your meal with a veggie may also help blunt that blood sugar spike. All right, number three, track the way exercise and stress impacts your blood sugar. So over here, we can kind of see the things that historically increase our blood sugar: food, illness, and stress, and then the things that typically bring it back down. So exercise, medications, and insulin. So try it out. So try going on a walk after a meal, open up your app and see the way that your blood sugar responds. The point of this technology is we're taking note of these things, and hopefully this will help reinforce, building step goals and building positive habits. All right, number four, reflect on what works and try to replicate the good days. So the app will allow you to track will allow you to track days that maybe you had a higher time in range versus days where you may have had more spikes and maybe a lower time in range. Think back to those days, review your notes, see what you did well, try to replicate the good days, and hopefully you can use that information again to build positive, lasting habits. All right. Number 5, and so this is especially important if we are on medications that lower our blood sugar too much, things like glipizide, sulfonylureas, or insulin. Act on low blood sugar before it occurs. So now, if we're going too low, that also affects our time in range. So pay attention to not only the number that your continuous glucose monitor is displaying, but also the trend arrows. You can see here next to this 75, it says the reading is currently 75, but the blood sugar is dropping. Use this as an opportunity to go eat something. Don't wait until you're below 70. Because sometimes what ends up happening is we end up overcorrecting, and then now we're causing our blood sugar to spike. The benefit of these products is we can catch it before low blood sugar becomes an issue. Another feature that the prescription continuous glucose monitors have are customizable alerts. So the Dexcom product, for example, to the right here has an urgent low soon alert. It'll actually let you know if they see that your blood sugar is rapidly dropping and you may experience a low blood sugar event. You can even change your alerts to a higher number if you're afraid of going low, so that your phone or device will alert you sooner and you can act on it sooner. All right, and then finally, number 6, remember to follow up with your healthcare team regularly. So the benefit with CGM is it gives you, as a person living with diabetes or someone who wants to better manage their blood sugar, it gives you a lot of information on how you can make positive changes to your diet and your lifestyle, but also it gives us, as members of your healthcare team, a lot of valuable information as well. So remember to check in with your healthcare providers. Most of these products, with the exception of one of the over-the-counter products, allows you to share your data with your healthcare team. You can discuss trends. You can use it as an opportunity to have conversations, make treatment goals, and adjust medications as appropriate based off on all this data. The other thing I also wanted to mention is make sure in this process you're having conversation of what your treatment goals are for you and having an understanding of what is too high, what is too low, and at which point your healthcare team wants you to bring what you find through this process to their attention. All right. So now we'll kind of take a moment to talk about the over-the-counter continuous glucose monitors. You'll notice they'll use the word biosensor. I'm going to talk in a little bit more detail about the product Stelo by Dexcom, only because I recently gave it a try, so it's a little bit fresh in my mind, but I'll highlight a couple of differences between this and the other over-the-counter product called the Lingo. So the over-the-counter products are relatively new. They were released over the summer. And with the over-the-counter products being released to the public without a prescription, I think it's pretty important to highlight that these are being marketed not only for patients living with diabetes, but also patients with prediabetes and really anyone who's just interested in tracking their blood sugars, their blood glucose for wellness and for their own personal health insights. So again, the two that have been that have come to market in the past year are called the Stelo by Dexcom, Lingo by Abbott. Both of these are manufacturers that also manufacture the prescription continuous glucose monitors. They use the same technology. The sensor that you wear on your arm uses the same technology. But again, these are open to basically anyone who's interested in tracking their blood sugars. So there are some key differences that I'll point out with the user experience when you're using the app. So before you consider purchasing an over-the-counter biosensor or continuous glucose monitor, there's a couple of things I would want you to stop and consider. Number one, are you on insulin or are you worried about low blood sugar? This is really important because the over-the-counter products do not have those safety alerts that I mentioned, so it won't warn you if your blood sugar is going too low. Number two, do you have a compatible smartphone? These products, you have to download an app. Your phone needs to be compatible with the app. There are not external readers that you can purchase to view the data. My big trick, yes, you can go online and see if your smartphone is compatible, but my cheat is just going into your app store or the Play Store and just seeing if you can download the app. Typically, it's safe to say if you can download the app, you can use the product. Third thing to consider, how often do you want to be able to view the data? For example, Stelo by Dexcom, even though, so the Dexcom, the G7 product, the prescription product displays a new reading every 5 minutes. The Stelo actually displays readings only every 15 minutes. This is particularly problematic again if you're on insulin and you require the data for dosing. So for this reason, again, do not use these products. Go for a prescription product if you are using insulin. They are not covered by insurance. They are over the counter, but you can use your FSA or HSA card. And kind of a more positive thing to consider, if you're on the fence, if you're concerned about paying out of pocket, for one of these products, keep in mind that applicable to any CGM, starting CGM and getting the information and the insights could actually, in some cases, be as effective as starting a new medication. All right. So quick note about time and range when we're looking at the over-the-counter CGM products. So because, again, these are available to anyone, including those without diabetes, the time and range is different. I highlighted on the right here, the time and range instead of 70 to 180 is actually 70 to 140, and the time and range goal is 96%. That is a much higher number than the time and range goal for most patients living with diabetes. I caution patients living with diabetes against trying to compare their blood sugar numbers to their friends or family members who may be using these products for wellness purposes. Just the mere fact that it's not, the goals are just completely different and your blood sugar is not going to respond the same. All right. So kind of getting into how do the over-the-counter products differ from the prescription products. So on the left-hand side, these are screenshots from the Stelo. On the right-hand side, it's a screenshot of the Dexcom G7, the prescription product made by the same manufacturer. At first glance, they actually look really similar. You can track your blood sugar trends, you can look at time and range, and then you can view your most recent blood sugar reading at the top with trend arrows to indicate whether or not your blood sugar is rising, falling, or staying the same. But what is different? So I kind of went through these tips a little bit earlier about how to get the most of your CGM experience. The big difference is that Stelo actually does kind of some of this reflecting for you. So Stelo offers personalized insights, basically prompting you to compare day to day your time and range and the way it's changed day to day. And it also has a tab, a Learn tab, for you to view basic nutrition and lifestyle recommendations that could also help you improve your time and range. So kind of a lot of those tips that I just gave you a little bit earlier are actually built into the app. As of right now, the prescription products don't have this feature. Another feature that the Stelo by Dexcom has that the Dexcom G7 does not have is what they call spike detection. So Dexcom the prescription product will give you alerts if your blood sugar spikes high. Typically, you can change the alert. Typically, it's around 250 is the default. Stelo offers a spike detection feature. It's not going to alarm in the same way that a prescription CGM would, but a pop-up will come up on your phone, and the app will actually walk you through kind of actionable steps that you can try to help get your blood sugar back down. So, like I mentioned before, going on a walk after your meal, staying hydrated throughout the day, stress relief and meditation, and also taking the time to reflect on maybe did you eat something that could have possibly spiked your blood sugar, and it'll prompt you to take notes and reflect on this. All right. And then what does Stelo not have? I emphasize this a lot for safety purposes, especially if you are someone who is on insulin or, again, someone taking medications that lower blood sugar, or frankly, if you just fear low blood sugar. Stelo does not have customizable alerts that alert you when your blood sugar is either dropping quickly, or is spiking too high. Again, spike detection is available, but it's not associated with an alarm or an audible alert. So the over-the-counter products, they may not display, or at least the Stelo does not display a new reading as quickly. However, it does save the data. You can still share your data with your healthcare provider if you are using the Stelo. To the right over here is kind of my view. So if I'm assessing a patient's blood sugar, actually this is my blood sugar, I can actually take a look at your trends and go through a pretty comprehensive report with you at a visit to go through all of your blood sugar data, trends for 15 days, the 15 days of wear. All right. So I talked a lot about Stelo. Again, I'm not trying to advocate Stelo particularly, but it just happens to be the product that I recently tried out a few weeks ago. Lingo is also available. Lingo looks a lot like the Freestyle Libre. which is the prescription version. It's made by Abbott. Like the Stelo, it is a over-the-counter continuous glucose monitor. It does offer personalized insights. It is useful for tracking the way your blood sugar responds to diet and exercise. A couple of key differences that I've identified, full disclosure, I haven't tried the product. I asked to try the product. They didn't provide me with the sample. But Lingo does not display time and range. There right now is not a function to share your data with your healthcare team. It's more for you to reflect on your diet and exercise. And as of right now, if you're an Android user, it's actually only available for iPhone. All right. So now, which product should I choose? Again, keep in mind, we have over-the-counter biosensors or continuous glucose monitors available. However, for these patients with type 1 diabetes, because they're typically treated with insulin, patients with any other type of diabetes on insulin, patients who are prone to low blood sugar or are high risk for low blood sugar, patients on certain types of diabetes technologies, such as insulin pumps, patients with diabetes who are pregnant because we go for tighter blood sugar control, or really, frankly, if you want those alerts that I talked about, some people actually want to be told they want their phone to go off if their blood sugar is running high or is at danger of going low. For these patients, I would say choose a prescription product. And so a note about insurance coverage. So again, over-the-counter is not going to be covered by insurance. You can use your FSA or HSA card. Only the prescription products such as the Dexcom G7 or the Freestyle Libre line will be covered. For Medicare or Medi-Cal, normally you would need to be treated with insulin. It could even just be one injection of insulin a day, or you have problems with low blood sugars, and so they define it as 2 or more problematic low blood sugar events to less than 54. These are the scenarios where the prescription CGM will be covered under Medicare and Medi-Cal. Commercial insurance, it's variable. I've seen some be more generous, some be more strict. Some insurance plans are still requiring patients to use multiple daily doses of insulin. But this is just a snapshot of in which cases the prescription products would be covered. Even if a prescription product is not covered, there is always an option to pay out of pocket for it. I highlighted in red the cash prices and the GoodRx prices of the different products. Stelo and Lingo are pretty comparable in price, $89 to $99 for 1 month. You can purchase them without a prescription on their respective websites. Dexcom of the 4 tend to be a little bit more expensive, but pretty comparable to the cash price of the Freestyle Libre 3 and 3 Plus. Of note, if you are either uninsured or have commercial insurance, so not Medi-Cal or Medicare, you may be able to qualify for a patient assistance program through the manufacturer, Abbott, for the Freestyle Libre 3 or 3 Plus. Right now, it's typically maxing out at about $74.99 for two sensors, good for 1 month. Should you want to pay out of pocket for a prescription CGM product. All right. And so now, kind of wrapping up, I'm going to end with kind of some tips. This is just, these are things that tend to come up when I'm working with patients and suggesting CGM when patients are either on the fence or feel like they may not want to continue with CGM. So kind of just a few useful tips. All right. So what if you're hesitant? If you're hesitant about starting CGM, I always try to start with a short trial. So 2 weeks, one sensor, or maybe even 1 month tends to be low commitment. If your healthcare provider happens to have samples in their office, it's no cost to you, but that's provider dependent. Even using the CGM for 2 weeks, sometimes we're surprised in how much we learn about how our lifestyle, our dietary change, our dietary choices can affect our blood sugar. And after the 2 weeks, you can decide for yourself whether or not you want to continue paying for the CGM or using the CGM. I will say though, if you do a 2 week trial of a CGM, even if you decide it's not for you, I still would recommend sitting down, try to time a follow-up visit shortly after your 2 week trial to discuss what you found with your healthcare team. This allows your healthcare provider to take a look at your data, and maybe they can make a couple of medication adjustments for you to help optimize your blood sugar based off of just a 2 weeks worth of data. All right. Couple things to keep in mind. So I often get this feedback that, well, it doesn't seem like my sensor is very accurate. I think it's important to consider that the sensor, many sensors can vary from finger stick checking by up to about 20%. What is the reason for that? So remember your finger stick, you take a sample of your blood, you're testing your blood directly. With a CGM product, the sugar has to go from your blood into this other fluid, the interstitial space. And so there's a little bit of a delay. So bear in mind that if you take a finger stick and check your CGM, there's scenarios where it may not be exactly the same, especially if you just ate, you just exercise, and your blood sugar is changing rapidly. Second thing to keep in mind, sensors tend to be a little bit less accurate in the first day of wear. Remember that you wear them up to 10 to 14 days. Keep that in mind if you're trying to compare your finger stick to your CGM reading. But if you're consistently finding that the numbers are way off, reach out to the manufacturer. I would say that most of these manufacturers, if they do suspect a faulty sensor, are pretty good about replacing it and sending you a new one. All right. Number 2, do not throw away your test strips and glucometer just yet. So big benefit to CGM is maybe you don't have to do finger sticks as often. However, there are scenarios where we want to double check a blood sugar reading. So kind of like what we mentioned, if it seems in the prior slide, if it seems like the numbers are just way off based on how you feel, maybe you feel a little shaky, maybe you feel like your blood sugar is dropping too low, but you're checking your CGM reading and it's saying it's normal, do a finger stick. The finger stick is still going to be a little bit more representative of what your blood sugar reading is right now. So anytime you don't feel the way that your CGM is, you don't feel like the level that your CGM is displaying, when in doubt, double check with the finger stick. Second thing to bear in mind, if you are experiencing a low blood sugar event, again, because your finger stick is going to be more representative of what's going on right now, if you're trying to get your blood sugar back up and treating a low blood sugar event, use your finger stick glucometer rather than your continuous glucose monitor reading. Okay. Adhesion guides are available if you have trouble keeping your sensor on. I will say this is pretty common. I have certain patients who just always have issues with the sensors falling off. Typically, prepping the skin appropriately, cleaning the area, making sure it's clean and dry first, applying the sensor and then covering it with some type of overpatch. So an overpatch is kind of like this purple circle that you see here. Normally that's enough to keep it on. However, both Stelo and Dexcom author pretty comprehensive guides on extra tips, extra products that you can use, such as wipes that increase stickiness, and other tips to keep the blood sugar, or excuse me, the sensor on a little bit longer for the full 10 to 15 days of wear. If you're someone that tends to have sensitivities to adhesives, you may still be able to use a CGM, and even if you've had a localized reaction to the adhesive of one of the products, here are some tips. So there's skin prep products, there's barrier products that can help minimize the irritation. And the one that's kind of surprising for most patients is actually Flonase. So spraying Flonase is a steroid. Spraying Flonase on the skin prior to the applying the sensor, letting it dry first, of course, can actually minimize irritation as well. Again, Dexcom and another site that I use for reference, Panther, both of these actually author some really good articles with recommendations. And then finally, number 5, if you experience issues with your sensor, contact the manufacturer for a replacement. So I hate to say it, it's not uncommon for these to malfunction. They are, for the most part, really accurate, but things do go wrong, especially if you have a copay or you're paying out of pocket for the product. Call customer service. So typically, a lot of them will even have customer service numbers on the box, or go to the website. The manufacturer will often replace faulty sensors. Even in some cases, I know Dexcom, the sensors do need to be removed for MRIs. Some manufacturers will even replace sensors that needed to be removed for MRIs, or even if they've prematurely fallen off. All right. Home stretch here. I know I've given you guys a lot of information. I talked a lot about making the most of your experience with CGM, but I also want to offer a few resources on what you can use alongside the CGM. So these are a few apps that we often recommend to our patients. A lot of these are carb counting apps. People have different preferences. So I know Figly and Carbs and Cows, a lot of patients like to look at the visual portion size to help estimate carb content of their meals. MyFitnessPal is a common one for a lot of patients who are fitness, wellness focus as well. If you want a book, there are Carbs and Cals books and also the Calorie King book as well, if you wanted something to go alongside your CGM to help you track calories and carbs. Okay. A couple of useful websites. So this is the NovoCare website. This is available to patients. This has a lot of patient education. I often refer patients here as because they have a lot of good kind of introduction to, eating well, meal planning type of resources, articles, and also articles such as, what healthy eating when you're out, when you're on trips or traveling, and some links to diabetes-friendly websites. And then Diabetes Food Hub. So Diabetes Food Hub is through the authored by the American Diabetes Association. They also have a lot of diabetes-friendly recipes. I like to direct patients here because I know sometimes we talk kind of about the concepts of healthy eating, but sometimes we just want to see it all packaged up in a recipe. So Diabetes Food Hub is another resource. And finally, if you kind of want to make sense of the data, so I kind of went over a basic overview of that new metric, the time and range. These are two patient-friendly resources for you to help understand time and range a little bit better. timeandrange.org, and then also Dietary, for those who want a little bit more information. And with that, that is the end of my talk. Happy to answer any questions from any of the viewers.
Great. Thank you so much for the informative talk. We do have some questions. So starting off with the first one, if your CGM shows spikes after every meal, but your time and range is still 70% or above, is this okay?
It's a very good question. So I guess here's the thing with living with diabetes, we understand that we're not aiming for 100%. I tried to kind of look big picture. Are we getting that blood sugar back down into range after the meal, or are you kind of staying up? But kind of to answer the question, the target is time and range of 70. I still kind of want to get the curve as flat as possible, and try as much as possible to get the blood sugars below 180 after meal, and also still continue to reflect on what may be causing those blood sugar spikes. But to kind of put it simply, the metric is time and range of 70% or greater, acknowledging that you will have times where you're out of range. And then to kind of second piece of your question, we're also looking at the percentage of time you are above range. So if you're spiking up, we also want to keep the high blood sugar below 25%.
Great. Thank you. Another question is there an alternative location that you can place the sensor instead of the arm?
It's an excellent question, and it comes up a lot. The short answer is the newer products recommend the upper arm because it was found to be the most accurate. The Dexcom G7, which was the iteration just before the Dexcom G6, which was right before the Dexcom G7, it actually was worn on the abdomen. We do have to say, if you choose an alternative site, it may not be as accurate as the back of the arm, but there is an argument that there may be some value in tracking the trends at an alternative site, but we do have to say, um, if the manufacturer recommends it to be placed at the top of the arm, that is likely going to be the most accurate spot for it.
Great. Thank you for that. And then last question, what is the range of lag time between blood and interstitial fluid?
Yeah, good question. It really depends on how quickly your blood sugar is rising and falling. For example, I mentioned like if you've just eaten, if you just took insulin, if you just exercise. I'll hear things like roughly about 15 minutes. I've heard different numbers, but I hear it's about 15 minutes.
All right, thank you. It looks like those are all the questions. Thank you so much, Kristina, for your presentation and your expertise. Oh, actually, there is one more question. Okay, someone's asking if there might be a difference in glucose levels in different body sites. So perhaps if you take blood from different parts of the body.
Um, Are you, I guess to clarify, are you referring to placing the sensor in different body sites, or you mean performing there have been studies. I frankly don't have them off the top of my head, but if we're talking about placement, there have been studies to show that abdomen was a little bit less accurate than the upper arm, if that's what you're talking about, or even I know sometimes they'll people want to place it at the kind of the lower back, for lack of a better way of saying it, kind of love handle area. That is okay for children per some of the CGM manufacturers, but I don't have the numbers off the top of my head. I will say, though, that there were studies to just show that upper arm tends to be the most accurate.
Great. Thank you so much for clarifying. All right. Well, thank you everyone for tuning in. Our next webinar will be taking place the second Thursday of next month and for every month thereafter. Thank you so much for joining, and thank you, Kristina, again.
Thank you, everyone.